What's up, it's your favorite NPHP, and welcome back to my channel. We are going to be discussing imposter syndrome. What is imposter syndrome? Who's affected by imposter syndrome? What are the symptoms? How do we overcome it? And most specifically, are you dealing with imposter syndrome? Imposter syndrome is also known as imposterism or imposter phenomenon. So it was first discovered back in 1978 by the psychologists Dr. Imes and Dr. Clance. Imposter syndrome, it refers to a false internal experience of low intelligence or ability in which someone struggles to believe that they deserve their achievements, which leads to downing themselves. It causes an individual to feel like they aren't as smart or capable as others think they are. So imposter syndrome has been with us for the past 50 plus years, but know that it is not an official psychiatric condition. Know that it can be linked to other mental problems and lead to other mental problems like anxiety and depression, which we'll discuss a little bit later. It's the high achievers, it's the perfectionists, it's adults who face intense academic pressure as children, and those who are from competitive backgrounds. These are our doctors, residents, our lawyers, our professors, our celebrities. 80 to 100% of nurses or nurse practitioners will experience this, and about 7 out of 10 adults will experience imposter syndrome within their lifetime. Referring to the nurses, it's due to that transition, going from a student nurse or student nurse practitioner in undergrad or in graduate school and transitioning into practicing on your own, right? This actually reminds me of my last video when I talked about that learning curve. So that learning curve that we experience when we're now practicing, what we are dealing with that can trigger, that could bring on the imposter syndrome, the feeling of not knowing. So we're going from being students in like our lecture hall, we're under the wing of our professors, we're under the wing of our clinical instructors, our preceptors, and then it's like, the next day you graduate, you pass your boards, and now you're practicing. Nurses, you're providing direct patient care, and nurse practitioners, we are ordering life-saving measures now alongside seasoned medical professionals. Imposter syndrome, it's that feeling, it's that thought of us not thinking we are smart, us feeling that we're not capable of doing what we just sat 4 years in school for, just sat for the boards and passed the boards. Again, keep in mind, imposter syndrome is a feeling, it's a thought. So let's jump into some symptoms of imposter syndrome. Feeling like you're fake or you are a fraud, fear of being seen as a failure, credit your luck or other reasons for any success, feeling that overworking is the only way to meet expectations, feeling unworthy of attention or affection, downplaying your accomplishments, holding back from reaching attainable goals, doubting your abilities as a nurse, and worrying that others might find out that you're not good enough. Again, so those are the symptoms of it, which leads me into the negative outcomes of imposter syndrome, right? Remember, these are internal feelings. Again, I want to emphasize they're internal feelings. These are thoughts, right? But they can manifest externally as behaviors, and that's what we do not want it to become. You're belittling your achievement. You're avoiding professional challenges out of fear. You develop social anxiety. And like I mentioned earlier, this could lead to anxiety and depression, and which all can affect patient care and ultimately your career. So there's steps to imposter syndrome. It starts out as that feeling, as that thought, I can't do it thought. And then it develops into behaviors of self-sabotaging, and you're belittling your achievements. And you're thinking like, I just got through because of luck. And now the behaviors, the anxiety, depression, that's now in turn going to affect the way you care for patients. So although imposter syndrome is a thought, is a feeling, it ultimately can ruin your career. When it takes hold of you is when you're coming to work depressed, not loving what you're doing anymore, feeling down all the time. Just imagine feeling that, and then you're supposed to take care of a patient. Next, we're going to discuss how to overcome imposter syndrome. First thing, we got to separate our feelings from facts. That's what this is. It's a feeling, it's a thought. But when I tell you this feeling and thought, if it's not taken care of in the beginning stages, it can manifest and grow into anxiety and depression. As for my nurses and nurse practitioner, for my healthcare provider, knowing what this is before you feel it, before you develop it, I feel like you'll be able to stop it in its tracks before it takes a hold of you completely. I actually diagnosed myself with postpartum depression. I knew knew what it was. I learned it in school. The feelings that I was having, I knew it was parallel to, the symptoms of postpartum depression. And I took myself in and I told my doctor, like, I am suffering from this. I need treatment. I need help because I know the outcome and I don't want to get there. So this is why I'm creating this video, so you guys could be aware of imposter syndrome and not let it take a hold of you. Stop it in the beginning. Stop it when you first develop those thoughts, so you don't fall too deep into it, because this could become a serious problem if it's not handled appropriately. So back to some ways to overcome it. Like I said, the first thing, we're going to separate our feelings from facts. Be ready. Be ready, observe what you're dealing with, know that it's imposter syndrome. Thought, it's a feeling, just nip it in the butt, stop it. So for example, if your mind is telling you don't know what you're doing, you don't know what you're talking about, stop it. But yes, I do. Like, fight yourself, fight your mind, because all it is thoughts and feelings, okay? Number 2 is change your mindset and acknowledge your accomplishments and achievement. In the moment when you just feel like you're less than, you're not capable of, remind yourself of the achievements. Like, I did go to graduate school full-time, working full-time, taking care of the family. I did pass my boards on the first try. You know what I'm saying? You have to change your mindset, and it's basically you're thinking happy thoughts. Get rid of those negative thoughts. Get rid of the I can't, what ifs. You got to get rid of it and remind yourself again of the facts, of your accomplishment, of your achievement, that you did it. No one else did it but you. Number 3 is stop comparing. Stop comparing yourself to others. You don't know what that person is going through mentally, first and foremost, and you got to figure out what it takes for you to stop comparing yourself. I know I used to compare myself to social media. When I tell you I haven't been on Facebook for the last, how old is my son? My son is 13, so I haven't been on Facebook for the last 15 years. I haven't been on Instagram maybe for the last 10 years. I took TikTok off my phone for the last now 5 years. Only social media I utilize is YouTube, because I know I tend to compare myself to the fake world of social media. And okay, maybe not all things are fake. The majority of the things that are shown on social media are not true. False advertising of their people's happy lives, people's accomplishments, the amount of money they have, a lot of it is false. First of all, who are you comparing yourself to? If it's social media, get off of that social media. Focus on you. Focus on your own achievements. Focus on your own measurements. At the end of the day, it's you're taking care of the patient, not the person you're comparing yourself to. One thing I got to emphasize about who are you comparing yourself to? Remember that the smart, high achievers are the ones who are experiencing imposter syndrome, right? So if you're comparing yourself to somebody else who's experiencing imposter syndrome, I mean, kudos, because you guys are both smart. You guys are both high achievers. But remember, an imposter is an imposter. Imposter syndrome only affects the smart, high achieving, perfectionist individuals. An imposter is an imposter. An imposter is a fake. So you got to know who you're even comparing yourself to. Don't compare yourself to an imposter. True imposters don't have this feeling of imposter syndrome. Number 4 will be just having people to talk to. If it's a close friend, just having the right people, just hearing words of encouragement. And sometimes you may need a therapist. Therapists can help you develop behaviors to stop the thought in its track. Because it starts with I can't do this, I can't do that. So therapists can help you develop behaviors, help you with your train of thought. And this is what it's all about. Try to get rid of that negative thought, the negative thought that you can't do it because you can. And understanding imposter syndrome. Imposter syndrome affects those who are smart, the high achievers, the perfectionists, okay? An imposter cannot have these symptoms, cannot develop these feelings. Why? Because they're imposters, they're fakes. So you have to remember that and keep that in mind, okay? And then again, this is my goal, to make sure you guys know when these feelings, when you guys are finishing school and these feelings and thoughts start creeping up, your favorite NPHP said, this feeling is normal. And if it affects the smart high achievers, if you don't feel it, okay, you may be an imposter, but it's okay. But we just have to learn how to stop those thoughts in its track before it gets worse, right? Before it leads to the behaviors, before it leads into deep anxiety and depression, and before it starts affecting your patient care. We don't want it, and then ultimately your career. Do not let this take a hold of you. So the big question of this video, are you suffering from imposter syndrome? So like I said, Dr. Ilms and Dr. Clance were the psychologists that discovered imposter syndrome. But Dr. Clance actually developed the imposter test, which I will link in my description, and you'll be able to take the test to see if you are dealing with imposter syndrome. So basically, the test will let you know if you have imposter traits, If so, how much of it is affecting you? The higher the score, more frequently and seriously, imposter syndrome is, or imposter phenomenon is interfering with your life. And if you are scoring higher on this test, please utilize these ways. If it's really interfering with your life, you may need to seek out a therapist at this time. My thoughts used to get a hold of me, not just nursing, it's just everyday struggles that I may face. It used to get a hold of me. Let me clarify. It used to. I mean, if you haven't watched my first video back in January, coming back and just giving you guys a testimony of my life, I am a child of God, 100% believer of the Lord. And when I tell you, when a negative thought just tries to get in my mind, I halt it. I give it to the Lord. I say, take it away. When I tell you, I strive to just live a positive life. Yes, I may react to things, but I catch myself. And if it ain't me catching my own self, it's my children like, Mom. And I'm like, you're right. In my household, we help each other. We do not let it take a hold of us, because we all know it's a thought, and that thought could, spiral and build on itself. Small little thought into like the what ifs, into a whirlwind of negative, false thoughts that we don't need to be dealing with. Any negative thoughts comes to mind, I try to push it to the Lord immediately. No hesitation, because like I said, I know how I am, and I'm one that I'll just continue to build, and now this little thought becomes this big lie in my head, and I'm just fighting myself, and because that's what that is. You're fighting your own thoughts, you're fighting your own feelings, and majority of the time they're false. So that's enough about imposter syndrome. Let's end this video with a Bible verse, of course. And today's Bible verse is Luke 21:19. Stand firm and you will win life. Focus on the Lord, be patient, and to not be afraid. We will experience the challenges. This is not just regarding nursing, just in life. Challenges in life, obstacles in life, but we need to pray. Focus on the Lord and pray for the strength to get through this. Pray for guidance, for Him to help you through. Know that He does not want you, the Lord does not want you to live this life on your own. He wants to hold your hand and guide you, but you got to be willing to extend that hand. Let Him guide you, let Him lead you, let Him help you. Until next time.